then you're off.
Okay, so remember, the stretches are put together to hit the most common myofascial trigger points in that area. Does that make sense?
Yeah.
Now, trigger points, and I don't have the chart, but I got pictures. What a trigger point is where a muscle shortens so it starts to contract and the fibers literally start to ball up and they form a knot, okay? We'll kind of poke around in a couple of you guys here and check if that's okay. We'll show you some knots, okay? So, for instance, let's say I sit all day and I do this. So I start to develop, because this shortens up, yep, some knots in there. So how, that's how we stretch it. And the pulling apart is one of the best ways to get rid of the knots. So we stretch that trigger point. Now look. And you'll have these charts that are coming, Aaron, because we didn't order them for all, but Aaron emailed me. So, and the points will refer. A referral pain is, are you guys familiar that the man with a heart attack might feel pain down the arm? Mm-hmm. Okay. We call the arm pain a referral pain. The reason it's a referral pain, it's not an actual pain in the arm. There's nothing going on wrong with the arm, is there? Mm-hmm. Arm's normal. The problem is muscle tissue in the heart has been damaged. The brain perceives it in the arm. That's why we call it a referral. Okay? So, for instance, we can get a knot there, and it will cause, in the area of red is where it causes pain. So, are these?
That's weird.
Yeah, I know it is. Real quick, I hope you guys appreciate this. I believe that the musculoskeletal nervous system is the hardest to deal with. If you're a cardiologist, there's 4 chambers. There's about eight vessels. You know what I'm trying to say?
Yeah.
And it's pretty easy, actually.
Yeah.
Do you see what I'm saying?
Yeah.
But the musculoskeletal system, if it was so easy that I hurt here and my problem is here, yeah. It's not. It's never that way. So these knots can do what we're calling refer. So you might have a knot way down there.
That'll make your...
You see what I'm saying? So, but and those are the traps. Are we stretching those? Absolutely, we're stretching those. So I want to show you a couple more.
Can stress cause knots?
Yes. Stress, poor posture, even poor diet, genetics. So if you're born with a scoliosis, if I'm like this, and I'm going to exaggerate it, this is tight. This is loose. I don't bend very well out of the scoliosis. I bend good into it, but everything here tightens up. We're going to get some knots. Look at knots back there, and we are stretching those, cause headaches.
What?
Yeah.
They learned something.
Look at here. Yeah, look at here. Knots here. Where are they going to feel it? Headaches.
Wow.
You see what I'm saying? Let me show you the.
You dug in one in my head last year.
It's like, what did you do?
Did I?
Yeah.
Did you feel it?
Yeah.
I kind of know where to get them. Oh, knots in the glutes, we're stretching all this, will actually cause pain to go down the leg. A knot here, which cause all that pain in that red area. Now the way that they analyze the red area is they put a whole bunch of patients, send an irritating substance, so they irritated the knot, and then they ask them whether they felt it. So the higher degree of red, the more they felt it in there. You see some of this ... not a lot felt some, but most of them felt it. You see what I'm saying?
Yeah.
In those 2 areas. I'm not sure he put the one I really wanted up. More. So we're stretching all those, oh, here's the one I really like. Look at this one, okay? You guys are familiar with the Cobra and the McKenzie, right?
Yes.
Okay, so we're really starting to stretch the joints down here. But the reason that we hold the head all the way back is to get an abdominal stretch, right? Mm-hmm. Okay, guess where knots here refer?
Says in your... Yeah.
Guess where not, and do we see that? Guess where knots here refer?
Back. That's crazy.
Yeah, that's the way the body is. Now look, I'm not saying this is the only cause of pain. It's probably not. It's not. Okay, but it's always associated. Does that make sense? So usually it's a stiff joint and some knots. So we have to work on both of them. Okay? So on the McKenzie, yeah, you want to feel, they want to feel the stretching here, so we stretch that out. Are those common? Heck yes. You know why? here's my abdominals. What do I do with my abdominals as I sit? They shorten. So, and if I'm sitting there a long time, especially the more I'm forward. the worse.
Yeah, that makes sense.
Exactly. Okay, so now I got some knots, tightness down here, now that pain pattern comes. Okay, so does that make sense? Now, there's several ways you can treat knots. I think the stretch is the best. Guess what? The acupuncturist, we got an acupuncturist that works for us. She needles them. Okay? Not in the clinic, obviously, but you can break up a knot with a needle. I'd rather stretch it myself because you can do it at home too, if that makes sense. Here's the cool thing. These knots are associated, 90% of them are the exact same points of the acupuncture system. Okay, so that's where you get some even more weird stuff. I have stretched the SCMs and cleared sinuses. And by the way, in the literature, it supports that. Okay, so I'll show you that. So remember, because the acupuncturists get those rude results, don't we? Mm-hmm. We're going to get some too, stretching out those knots. Because remember, they're about the same most of the time. Okay? Acupuncturists need, what does a massage therapist do?
Trigger points.
And that's what these are trigger points. So myofasciitis is a trigger point. Big doctors call it myofasciitis. Okay? So they get in there, yes, they get in there and go. Yep. By the way, as we loosen up the spine and get it to function better, the muscles will start to function better and stretch better. So just the, we'll call you back in 5 minutes, I'm in training. 10 minutes, 15 minutes, whatever. Okay. So as the joints loosen up,
That's part of the show, guys.
right, as the joints loosen up, naturally the muscle will start to function a little bit better and naturally pull that knot out. Okay, but my form of medicine is we jump on it hard. We're going to do a few things to pull that knot out, okay, to get a better result. Okay? Now, when I ask the doctors, how many patients have knots? All of them. I'm going to find a knot on everybody, okay? It's very, very, very common, okay? So most of them have it. It says if don't do this. Oh, now on the stretch, okay, if you don't do those stretches perfectly with the perfect angle, the stretches are designed to get the knot. Does that make sense? You'll miss knots if you don't get perfect angles. By the way, I've done this several times. Especially the lower back stretch, everybody wants to do knee to the same shoulder, don't they? It's opposite shoulder. Have you ever done it yourselves?
Yeah.
It's a huge difference, isn't it? Okay, we get actually one more muscle in there that way. That's a huge muscle.
Well, the lower back ones that you do are just good after any exercise, I've noticed. I do them every time.
Come on.
Niall, you better compliment him somewhere.
So,
I'm deprived.
Listen, I've been a chiropractor since the 1800s, okay? So, there's times where, are you stretching? Yes. Let me see what you're doing. Because I want to see what angles they're doing. Yeah, and there's a lot of times, I think I should be getting a little bit better benefit, but they're not got the angle correctly. So I'll correct the angle, and it helps tremendously. I've done that over and over and over and over again. That's why I will tell you 90% of plus patients, when we go over the stretches one time, will not be doing them all right. It's probably way higher than 90%.
Yeah.
Right? Okay. Okay. So that's the reason for the review. Okay. Any other questions on those nasty-o knots? Okay. Icing for inflammation. Everybody knows why we ice, right? Okay. It decreases the inflammatory component, right? Now, if you ice too long, the body perceives, hey, this has been cold too long, so it sends blood in to increase inflammation. That's why there's a time limit on the icing. So you might want to tell your patients, oh yeah, I go to bed with that ice pack. No, that's not what we want to do.
Yeah.
There's a certain time period that we want, okay? And then after we ice, if you want to ice again, which frequently we'll say 2-3 times a day, especially with a pinched nerve, that's an inflammation of the nerve, you want to wait for that whole area to warm up again, okay, and then hit it again. So wait about an hour, hour and a half in between icings. Special instructions. if they're doing 2 or more.
Oh.
Cool deal?
What's the best posture to have when icing? Sitting, not
No.
sitting, standing?
Well, so the lower back, if you've seen the video on the lower back,
Yeah.
I don't want them sitting. Why? That's just a bad posture.
Yeah.
Okay, they can make themselves worse, but they might not feel it because of the ice. Okay, so then we're in a pickle there. So I don't want them to sit. I don't want them to lay on the back. I just don't get a good result that way. I'll tell you if I don't know.
Like laying back with the ice.
Yeah,
on
some
it.
people just lay on an ice pack. I don't like that. But they can put it on, because remember, we're strapping it on. They can lay on their side. And really, I think it's good for them to kind of just walk around with it. Because you're having an effect on the pain, but you're still using your mechanics. And then there's a reason that's a little bit better. But obviously no bending and lifting. Because now they're not going to feel, oh, this was pretty good. You know what I'm saying? And yeah, you might irritate them because they're not feeling it. Heat generally causes inflammation. Okay, so it's going to send more blood in. That's going to cause the inflammation, the swelling to happen more. You hardly ever see an athlete on heat, do you? No. Okay, now, athletes have the best physicians, best chiropractors, best drugs, and what do they put on right away?
Ice.
$2 worth of ice, probably not even $2. Okay, so they're going to go with ice right away. So ice is a very, very beneficial one. Okay, we've got a tape of the lower back. Dr. Bodum, and tell him this by Sunday. You see him. Hey, Neil said you were going to get him over a icing of the neck video, and I'm getting fired if you don't do that. Okay.
I will do that.
I got 3 hugs, but I still might get fired. Okay, so we need a neck
So
video.
far, by the way, on the hugs.
So here's how I just don't want the neck to be iced like that. Some patients will put it on and kind of just lean forward.
And leave it there.
Yeah, that's gonna cause them the worst. I want that neck where they're sitting back, and you know what I'm trying to say, and there's no muscle contraction back there. They're kind of relaxed as they do it. Okay, but hopefully Dr. Bowden will put together it because it's not that hard. Oh, I forgot about the rolling knots. Where's that poster at? Let's go back to the myofasciitis. Here's the other thing that we're gonna start. Are you familiar with the foam rollers?
Not really.
Heard Dr.
I mean, I know what they
talk
are.
about it all the
Yeah.
time, but never.
Are we
So-
doing foam rollers?
Yeah, we're gonna get foam rollers done for the clinic.
Okay.
So, and we can show the patients on this, and you guys can do a little bit of this rolling. They might not do all of these, but they're rolling right over the trigger point. That's the same thing as a massage therapist hitting it. You see what I'm saying?
Yeah.
And it's another way for you guys to benefit. I don't do this way because I'm really into the stretching. I'm okay with this though.
Okay.
So you're gonna see a couple doctors who are gonna do it. I think Aaron liked it, didn't he?
There's
Somebody
foam
said-
rollers I've seen with.
Dr. Aaron always talks about the foam rollers.
Perfect.
He has talked about that to me.
Yeah, yeah.
I've never seen one, so I was like.
Yeah, so that's what they're talking about. We don't have any problem getting the foam rollers in the clinics, and I'm gonna push the doctors to get that. Okay, so our way of treating those trigger points is stretch, little foam roller.
Okay.
Correcting posture, manipulation to restore motion into the joints. Okay? We also do a little bit with stuff with posture. Did you guys see my sitting at the computer film?
I haven't seen that.
Okay,
I
I'm gonna
haven't
go.
seen it. I sent it out, but.
So listen, if you guys are wellness coordinating, okay, and that's what I want you to do is what, and then the sales will take care of itself, okay? Look at everything you send out. If you're wellness coordinating and you send something out and then they ask a question, you're like,
Yeah.
okay, that's bad. Okay, so just look at it. By the way, if they ask a question that you don't know, what's the response?
Yes, doctor.
Come here. In front of the camera so everybody sees I'm a good guy. Right, hey, that's a good question. Let me ask the doctor. Okay, and the patients like that too, don't they?
Yes.
Okay, so I'm sitting at the computer. I'm going to go over it right now. And here's what I tell my patients. You ready? If you do this, you're going to die.
Yeah.
And they all sit. Yep. By the way, do you see the research? The more sitting you do, the less healthy it is, right?
Yep.
Right? So, and one author calls sitting the new smoking. He thinks it's that deadly. Okay, so the less time you spend sitting, the better you do.
Stand up
So if
now.
we sit like this,
I want to live a happy
if we sit like this, we die, right? You know that. So here's what I tell them. Here's what I want you to do. Okay? I want you to get a lumbar support. Do you know what the lumbar support is? About half patients will know it, half won't. Do you guys know what the
I have
lumbar
one in
support
my car.
Yes,
Like
so the
pushes.
cars have that cushion to push the spine out. Watch my shoulders. You see how they
And you
roll
can
back?
just buy like inserts, right?
Yes.
That just like sit.
Yes, some will have inserts, and that's what I tell them. Some will have it right in the chairs. You can actually just get a towel and put it back there, can't you? The towel doesn't go all the way down, because where's the curve? Right here. So it's going above that bone. So I want, and I'll explain it that way. So lumbar support. I want them to lean back 10 to 15 degrees. Okay, because they're getting up. The worse they go forward, the more disc pressure. The more they go back, the less disc pressure. So this is going to take disc pressure off too. I want the elbows in. You know, if you did a mouse like this, how long? Not very long. The shoulder's going to start to ache, right? So you want to bring it in as much as possible. And here's what I tell them. I'm going to switch out what most ergonomics recommend. So ergonomic people recommend that computer screen is right in the middle of the eye level. With stuff up here, I don't want any down. I'll change it. Boom, boom, boom. I'm going to have them move the bottom of the computer to the eye level. Why? I kind of want to look them up. I want them to look up slightly. Do you see what I'm saying? Into this posture. If that doesn't work and they get worse, I will tell you, we just bring her down. Okay, so, but I want to try this.
Yeah.
Okay, now, if they're on a laptop, that's harder, isn't it? Because we can't,
It's
because,
also-
yes, okay? So what I tell them is bring the laptop up as much as you can. So, if you're all like this on a laptop, if you can bring it up this is better. This is better. This is better. As you go up and you get the bend into the wrist, you can get carpal tunnel. We'll deal with that if you get it. Let's just see if you feel better doing this. We'll adjust from there. Cool deal? So look at that video, understand that video, and then send that out. So then when a patient calls,